Hey there, thanks for tuning in today. I'm Dr. Morgan Nolte. I wanted to let you know that the video you're watching is a clip of a longer episode that's very in-depth about the best foods to eat to lower blood sugar. So if you're interested in learning more about that, I'll link the full video below in the description. Please be sure to subscribe to this channel, give the video a thumbs up, leave a comment, and share it with a friend if you find it helpful. Thanks for watching and enjoy this clip. Key takeaway number 7 is to optimize your micronutrients. Harvard Health has a great table of vitamins and minerals, many of which are needed to optimally metabolize our food. This table also reports the recommended amount of each micronutrient we get each day. I'll link to it in the description below, but the ones I'll be focusing on for blood sugar regulation are magnesium, chromium, cysteine, calcium, vitamin D, and zinc. Let's start with the mineral magnesium. One study reported that 25 to 39% of people with diabetes also have a magnesium deficiency. Their summary was that low magnesium is seen in type 2 diabetes, and there is an inverse correlation between the person's magnesium level and fasting and postprandial blood glucose levels. This means that those individuals with higher levels of magnesium had lower fasting glucose and better blood glucose responses after a meal. The study authors suggested that periodic monitoring of magnesium concentrations and magnesium supplementation can prevent chronic complications related to diabetes. Another study of 42 people with type 2 diabetes found that magnesium supplementation of 250 milligrams per day for 3 months helped to reduce insulin resistance and improved blood sugar control. The next micronutrient to consider is chromium. I found this 2021 systematic review and meta-analysis on the effect of chromium on blood glucose. This review included a total of 10 randomized controlled trials involving 509 patients. Its results were a little less thrilling than what I was hoping for. The meta-analysis results showed that the differences between the experimental group and the control group in only one indicator of hemoglobin A1C were statistically significant, while there were no statistically significant differences in other indicators. The use of chromium supplements can reduce the A1C of type 2 diabetic patients to a certain extent, but it cannot effectively improve fasting blood glucose and blood lipid levels in type 2 diabetic patients. So, you may get a slight benefit with a chromium supplement, but I would focus on magnesium first. Foods high in magnesium are leafy greens, pumpkin seeds, almonds, low sugar dark chocolate, some types of fish like salmon, mackerel, and halibut. The vitamin D family is also essential to ward off insulin resistance and improve your blood sugar regulation. Great natural sources of vitamin D include hello sunlight and fatty fish like tuna and salmon, egg yolks, cheese, and fortified milks. In Why We Get Sick, Dr. Bigman also identifies cysteine, calcium, or more specifically dairy, and zinc as important micronutrients to help with insulin resistance, which remember is at the core of prediabetes. So while you might not see a direct impact of these micronutrients on your blood sugar, you could be helping the root cause of your prediabetes. Other herbal supplements to consider would be adaptogens that can help you better adapt to and respond to stress, such as rhodiola, berberine, and cacao flavonoids. The book The XX Brain by Dr. Lisa Mosconi has helpful tables for different supplements to help for things like anxiety, depression, metabolism, and sleep. If you're looking for specific amounts to take per day, you can look to her book for reference. Be sure to always run a supplement by your doctor before taking them because they could interfere with the current medication. So, one more time, the micronutrients and supplements you could consider to help lower your blood sugar are magnesium, chromium, vitamin D, cysteine, calcium, zinc, rhodiola, berberine, and cacao flavonoids. Hopefully, if that's something you're interested in, This episode can serve as a springboard of a conversation with your doctor, or you can go down your own research rabbit hole. Remember though, you can never out-supplement an unhealthy lifestyle. Many lifestyle factors, not just what you eat, can impact your blood sugar. Food timing, sleep, stress, your environment or toxin exposure, and exercise are all areas you can optimize. It does take time and effort, but your health is worth it.